And we're live.
All right.
Yeah.
Good afternoon, everybody. My name is Beth Manley, and I'm ISAC's compliance officer. I'm going to go over some housekeeping before we get started. So we are recording the webinar, and then the slides will be available after the presentation. The presenter is going to make a couple updates to it, though, so it won't be available right away, but we will let you know when it is available. And the speakers are taking questions throughout the presentation, so you're welcome to use the Q&A feature or the chat box at the bottom of your screen. And now I'm happy to introduce our two speakers that we have with us today. We have Richard Sternadori, who is the Senior Project Coordinator and Research Director for the University of Missouri Great Plains ADA Center since 2008. He holds a Master of Architecture from the University of Missouri, where he's an instructor in the Architectural Studies Department. Richard also has a Master of Education in Counseling Psychology, and Richard serves as a member of the Texas American Institute of Architects Equity, Diversity, and Inclusiveness Committee and the International Code Council Assisted Toileting and Bathing Committees. And our second speaker is Dr. Candace L. Fisher-McLean, who is an Associate Extension Professor in Architectural Studies with the University of Missouri Extension. Dr. Fisher-McLean serves as the National Director of the Healthy Homes Training Center and Network and the National Coordinator of the Healthy Homes Partnership. She has over 13 years of Extension outreach and teaching experience. So I will hand it over to Richard now.
Thank you so much, Beth, and welcome everybody. Good afternoon. We are glad to be here, very excited to be here with you. And this presentation is really more about you than it is about us. This is coming back and reporting to you what we've learned from you over the past 5 years in your responses to an online survey we prepared. Just briefly, I'm with the Great Plains ADA Center, which is located at the University of Missouri, and so is Candace, Dr. Fisher-McLean. And right there, the slide that you see in front of you is our 800 number, works from across the United States. And I'll get into a little bit more about what our office does in a minute. Next slide, please. But the title of the research we did and today's presentation is the status of the ADA in local governments for persons with disabilities. And this is just the Iowa findings. So we did this across all 4 states, but we're reporting back to you thanks to ISAC. Next slide, please. So obviously we want to thank ISAC and Katie Cook, Beth Manley, and all the folks who supported us throughout this. And in particular, I want to thank Dr. Fisher-McLean. She's just been amazing throughout this process with the hard work that we did and that she did in getting us to this point after 5 years of research. Next slide, please. And that's our contact information, mine and Dr. Fisher-McLean's, and you can get a hold of us there. And also at the end of the slides, you'll see also contact information for the University Institutional Review Board. If you have any concerns at all about the research because it was based on human studies, as a research participant, you have the right to ask any questions about it, and it's open information to you. And our phone numbers are there as well as our emails if you would like follow up or again have any questions. Next slide, please. Our ADA Center is one of 10, and we were created right after the passage of the law, the ADA law in 1991. With the understanding that Congress knew this was a very complex law. It affected employment and it affected architecture, it affected all governments and everything you do in government. And so consequently, they created our centers. Next slide, please. And we are grant funded. There are 10 of our centers across the United States, all using the same 800 number. So if you happen to be in Region 7, Iowa, Missouri, Kansas, or Nebraska, you'll get our office in Columbia, Missouri. If you're in California, you'll get Region 9 office there in California. Next slide, please. So it's a nationwide number, and we do guidance, capacity building, obviously education, research, and we've got experts in those 10 centers on any topic of the ADA. It doesn't matter what the topic is. We've been at this 30 plus years since the passage of the law. This is our University of Missouri. We're in our 30th year right now. There's our ADA project website, and our 800 number was on the previous slides. Next slide, please. So we can assist you, we can assist persons with disabilities, governments, ADA coordinators, code officials. I'm a former code official, architects, et cetera, businesses. And so that's the gamut of the sociologically who we serve. One of the important things about this research is that about 1 in 5 of your citizens qualify under the ADA as having a disability. So it's almost 20%. It is the largest minority in the United States. Next slide, please. Briefly, there's 5 titles, if you will, of the ADA. I often say, just think of them as books on a shelf, each one being unique into itself. The first one is employment. So you as employers or you as employees have very specific rights under the Americans with Disabilities Act. If you're coming into a job new, or if you're just interviewing, if you're being transferred, fired, whatever it is, you have rights. And then Title II is public entities. That's you, state and local governments. That's also us as a university. And that's different than the rest of the world, Title III. So your mom and pops, I don't want to pick on anybody, but like Walmart's, those public accommodations are not under the same sets of regulations as we are as state and local government entities. Next slide, please. So under employment, anything to do with employment is covered under Title I of the ADA. Let's just move on to the next slide. We don't need this slide here. There are some limits to the ADA and to the architectural stuff that we will partially be discussing, and we can go to the next slide as well. We didn't really need those because what I really want to get to is program access in Title II. As a state and local government, this is critical that any program you offer, any service, any activity whatsoever must be accessible when it's viewed in its entirety for people with disabilities. Now, that could be your website, that could be your buildings. Obviously, it may be your buildings. That could be how your police interact with people, how they incarcerate, how they transport a prisoner or a suspect. It has to do with your websites, your documents. If you have a softball, if you have recreation parks, fire departments, all of these things are program services and activities that must be accessible when we view them in their entirety. And viewing it in its entirety is similar to when we have a parking lot where not every parking space is accessible, but you certainly have accessible parking spaces. So with Title II, you could in fact have, let's say, 10 swimming pools. And if 2 of those pools had the same amenities, vendors, same programs like swimming lessons, food service, et cetera, if 2 of them had all of the services of the other 8, and you combine them all into 2, then that's viewing aquatics in its entirety, and the other 8 don't need to be accessible. So we're not here to learn that so much, but I do want to point that out to you because it's really one of the unique things about state and local governments under the ADA. So let's get on to the research. Next slide, please. Before Candace came on board, Dr. Fisher McLean came on board, I was teaching a class to the Nebraska Intergovernmental Risk Management Association. There were about 250 people in the room. And I asked them who amongst them had what is called a self-evaluation of all their programs, services, and activities that I just mentioned. And also, first I asked if they knew what it was. And out of 250 people in the room, about 15 raised their hand. I asked them to keep their hands up if they had already performed their self-evaluation and created the document that's required there. And about 5 hands stayed up. At that point, I realized that we needed to survey all of the states in our region, the 4 states. And that began this process 5 years ago, really 6 years ago now. We wanted to understand where your governments were in terms of applying the ADA, and also some related provisions like building codes and that kind of thing. So we decided that we needed a framework to do that, to understand it. And we came upon what's called the Community Capitals Framework, where we're looking at 7 distinct topics or resources that you offer in your community, and focusing our questions in the survey on those 7 capitals toward these 4 goals. And the first goal was, how do we improve our delivery of our services from our ADA center to you and to the rest of our region, to the 4 states? We wanted to know what the impact of rural versus urban living or demographics is in local governments for the ADA application of the regulation. So is there a huge difference, and what are those differences, and why are those differences between the more rural and remote rural areas of Iowa and, let's say, Des Moines as an example, or some of the other, I think we picked out 8 major metropolitan areas in Iowa to focus on, and then the rural areas. And then we wanted to know how the responsiveness of your government affected the livability of the community for people with disabilities. So we'll talk about livability a little later, but we want to understand how your responsiveness in this situation affected that person's livability within your community. And then finally, how those findings can inform our educational programs. Next slide, please. We put together a series of 51 questions, 28 items, and then 23 sub-items, depending on how you answer. There's some skip logic to the research. Based on what's called the Community Capitals Framework, where we measured your natural, cultural, human, social, political, financial, and built capital of your community based on your answers. So these are the strengths of your community. It's not weaknesses. It's combining all of these capitals together. So the social capital might be the interaction of the local government with the disabilities community, or political capital might be the support that you have politically for, let's say, appropriate personnel, staffing, finances to implement the ADA. Let's go to the next slide. Candace, did you want to add anything about a community capital framework and the methods? Next slide.
Yeah, not at this point. I think you got it covered, Rich.
Thank you. So we put together this survey. It's just a questionnaire, essentially, but it's was mixed methods, meaning we had these specific answers, and then we also gave you the opportunity to respond in a qualitative sense, to write out some sentences and tell us qualitatively, you know, a little bit more about yourself. So what's called mixed methods. So as I said, we had 51 items, and we did this across 4 states and ended up with 387 total jurisdictions that participated. So that's pretty good. So that's about a 12, almost 13% response across the 4 states. In Iowa, we were very pleased to have a 44% response from Iowa County. So thank you for that. That was amazing. And that's a very high response rate. So that really helped us a lot to understand Iowa and Iowa counties. But overall, in the 4 states, we have, as I said, 387 jurisdictions involved with 51 items. If you do the math, and this is really back of the napkin math, you know, somewhere around 19,000 data points that Candace had to work through. That's pretty impressive. Let's move on. As you can see, we had a very high rural response. So in Iowa, we were looking at approximately 81% of the respondents being or self-reporting as rural, and about 11% self-reporting as being suburban. So we had 44 counties respond, and we had 55 cities respond, because this also, same survey that you got, went out to the League of Cities. Next slide, please. So I'm going to close down these cameras so I can see my entire set of slides. There we go. So what we had was, looking at those rural communities, we had quite a few that are population of 5,000 and under. And that's going to speak to several things, including livability of a community, because we found that rural communities are quite a bit different for livability for persons with disabilities, and also in resource allocation of the government, how that differed from the more urban and suburban areas. And you can see that only 2 responses were from jurisdictions of 100,000 or more, but the majority, 47%, or 47, pardon me, were 5,000 and under. Next slide, please. Now, this is a map Candace put together. Why don't you describe this for us, Candace? Because you did, this was a really a step forward for us in terms of how we understand things.
Yeah, sure. And I had a comment about the previous slide. You don't need to go back, but really nearly 2/3 of our respondents said that they had 10,000 or less. So between the 5,000 and 10,000 and 5,000 and under, 2/3 of our respondents, so they were from communities that were 10,000 and less. And those are just the communities that we surveyed. So I would imagine it would be much, much higher than that if we had all of Iowa participating in it. So, but as far as this map goes, so the blue dots are indicators of urban areas in Iowa. And off the top of my head, I'm not sure exactly what all those cities are, but I know in the middle is Des Moines and Iowa City. And then we've got Davenport and Dubuque, I believe, Waterloo, Sioux City, and some other ones. But the blue dot indicates the urban city area, and the yellow ring around there is a 25-mile radius within that city. And the areas that are filled in red are counties that responded. Areas in white are in the grayish white are counties that did not respond. But even just looking at the counties that responded in red, you can see that most of those, if not nearly all of them, are outside of outside of the 25-mile radius of metropolitan areas.
Right, and that's an important point, because obviously services to people with disabilities are much more prolific in the metropolitan areas. Candace, can you take it from here for a moment, please?
Sure. What else did you want me to describe?
I think we can just move on to the next slide.
Okay, great. Okay. So then we were looking at the ability, I believe the ability of jurisdictions to be able to apply ADA regulation. Well, sorry. So this slide is looking at how influential the disability community is on local governments. And I think the most predominant one here is that the largest percentage of jurisdictions said that they felt like the disability community was only slightly influential in the community. Only one jurisdiction said that they felt the disability community was extremely influential. Okay, so we can move on to the next slide. So then we looked at a jurisdiction's ability to apply ADA regulations based on a number of factors. And one of the things we looked at was sufficiency of financial resources. And most jurisdictions said that they felt that their financial resources to be able to apply ADA regulations are only moderately sufficient. And not too far from that, you can see that most jurisdictions said that they felt like financial resources were either not sufficient, slightly sufficient, or only moderately sufficient, which I think any community is going to, no matter what the issue is always going to struggle with financial resources. Okay, next slide. So then we specifically looked at financial resources that were directed towards targeting ADA regulations. So again, you can see the highest bars. 33 individuals only felt like financial resources were slightly sufficient in targeting ADA regulations, and at the most that they were moderately sufficient. Okay, next slide. Okay, so then next we looked at the sufficiency of personnel resources to be able to apply ADA regulations. And again, I think not surprisingly, 36 individuals felt like personnel resources were only slightly sufficient. political motivation to target ADA regulations was a little bit higher, with more individuals saying that they felt like it was moderately sufficient. Okay, next slides. All right, so every state and local government with 50 or more employees must have a central person or persons appointed as responsible ADA regulator for ADA regulations. This includes grievance procedures, employment and HR issues, public notices, and implementation of federal regulations. So the first thing we wanted to know was if the jurisdiction had 50 or more part-time employees. And you can see that it's nearly half and half. Just slightly more jurisdictions had 50 more employees than did not. However, for jurisdictions that responded that they had 50 or more employees, we wanted to know if they employed an ADA coordinator. And I think that this was important because only or about 41% said that they did employ an ADA coordinator, and nearly half said that they did not employ an ADA coordinator. Okay, next slide. Okay, Rich, do you want me to go over this, or do you want to do it, or do you want to go through this? So the functions of the ADA coordinator include conducting a self-evaluation of its services, policies, and practices, to notify applicants, participants, beneficiaries, and other interested persons of their rights and the city's obligations, department's regulations, to designate a responsible employee to coordinate its efforts to comply and carry out the city's ADA responsibilities, to establish a grievance procedure for resolving complaints of violations, to operate each program, services, or activity so that when viewed in its entirety is readily accessible and usable to individuals with disabilities. Physical changes to buildings in accordance with the department's Title II regulation, ADA standards for accessible design, or the Uniform Federal Accessibility Standards, to ensure that facilities for which construction or alteration was begun after January 26, 1992, are readily accessible to and usable by people with disabilities. And finally, to ensure that communications with applicants, participants, and members of the public with disabilities are as effective as communications with others. Okay. All right, next slide.
And we'd be glad to provide a copy of that. I see a question there.
Yeah.
No problem getting a copy of that. And Candace, thank you so much.
Sure, no problem.
I had to step away just for a moment.
Oh, that's okay.
Maybe I'm not needed. I think what's important about that is that what Candace was going through with you all is that if you have 50 or more employees, full or part-time, you are required to have a person that's, quote, the responsible person to implement all of those duties under the ADA, the grievance procedures, et cetera, et cetera. And that's just required. And what we learned from Iowa was that about 51% of the communities that should have an ADA coordinator do not. And then subsequent to that, about 3/4 of those people who do have ADA coordinators, or 3/4 of those people who responded as ADA coordinators, I think, were saying that they had less than 20% of their time to devote to the duties of the ADA coordinator. Now, this speaks to some of the capitals we talked about, such as human capital, such as political capital. Where are those strengths in your community? And so again, the community capital framework is not intended to measure your weaknesses. In fact, it's intended to measure all 7 of those capitals as a working unified model towards a healthy, accessible community. So in this case, I think what's most important, what we learned that I think was eye-opening for us, was that about half of the communities that responded we're saying they should have an ADA coordinator, but they do not. And we don't have a full response. We have a 44% county and 11% city response. Let's go to the next slide, please. The self-evaluation is another step that is required of you as a county government, regardless of how many employees you have. So back to the the ADA coordinator, that's only when you have 50 or more employees. And that's only Title II. So Title III, like again, let's go to Walmart again. They're not required to have an ADA coordinator. We're finding many Title III entities that do now, however, hire an ADA coordinator because of just it's the right thing to do, and there's litigation involved oftentimes, et cetera. But within governments, you're required to have evaluated your conditions. That is, what is the accessibility of your buildings? How is the accessibility of your police department? How are your employment processes? Are they discriminatory? How is your communication? Used to be, we'd see telephones, and you'd have the type of telephones within offices where a person could type, and they would have an operator to intercede with the communication for persons with blindness and deafness. But even for the smaller communities, if I were to come into your offices and stand at your counter, and let's say I have blindness or deafness, you have to be prepared to communicate with me effectively. Now, sometimes that can be just pencil and paper, but sometimes it means you need to print something in Braille, and that's your responsibility. Or sometimes it means you need to find a coordinator, an ADA interpreter, a sign language interpreter for persons with deafness. And that is your responsibility. And that's what the self-evaluation is intended to understand. And I will point out that the self-evaluation was supposed to be completed no later than 1995. So any entity that has not done that is sort of behind on the timing, on the 8 ball on that. When the Department of Justice does receive a complaint, and they've occurred in Des Moines and they've occurred all around you, the first 2 questions that the DOJ asks are, where is your self-evaluation and who is your ADA coordinator? So that's complaint-based. Let's move on, please. Next slide. As a portion of our wanting to learn more about your communities, and as a former building code official, I wanted to see how are we doing with facility access. Now, as a Title II, you're entitled to offer your programs, as I mentioned earlier, in an accessible manner when viewed in its entirety. So that gives you the right to offer your program services or activities in alternate locations or alternate means, by video, out on the bench in front of the county courthouse. It doesn't have to be right inside the building necessarily, but access to buildings includes access to healthcare, access to shopping, access to transportation, access just across the street, access to your government offices, and then the buildings themselves. So we started to get into building permits, plans, and inspections. We found that more than half, almost 60% of the respondents do issue building permits for new or altered construction and multifamily construction. Now, the ADA does not apply to single family or to duplex type homes, to 2-family homes, but most multifamily, and then of course new or altered commercial construction is required to meet accessibility standards of both the building code and the 2010 ADA standards, the federal regulations. That's the book on the left-hand side of your screen. So of those jurisdictions that issued building permits, a whopping 86% responded that they do require a review of the plans or blueprints prior to permit issuance, prior to issuing the permits. That's a big deal. As a person who oversaw an inspection department, the plan reviewer is sort of the safety net to make sure that the design is correct prior to it being constructed out of concrete and wood. It's better to catch a problem on paper. Let's move on to the next slide, please. So a high percentage of the communities did require plan reviews and permits. And I wanted to point out also that Lerka Vasilievich at the State of Iowa Fire Marshal's Division. They also will look at your blueprints and your properties, your construction projects at your request. And so you can contact the state of Iowa and ask them to intercede if you don't have the manpower as a small county government. Maybe you have 2 or 3 employees and you don't even have an inspector, then they can step in, and they do step in even without your request under other circumstances. The state statutes cover where their authority begins and ends there. But what we learned was that a significant number of these jurisdictions require plan reviews and issue permits, but don't do follow-up inspections. So we saw quite a few that while they're looking at a plan review and a permit, maybe we don't have a person showing up on site to make sure it was actually built like it was designed. And so we've kind of felt like that was an important finding here as well. And we think that that's going to play out more in the remote rural areas. Our ADA center and our 10 centers nationwide, but in particular ours, we are the liaison with the International Code Council. I teach with them. I develop educational programs, alongside them. And so we have a direct connection with the Code Council. And we think that that speaks very deeply to how we'll have to move forward in the future with what we've learned in this research and in our work with the Code Council. Next slide, please. So after the permit issuance, this is the slide I was mentioning about. We don't see the physical building inspections, only approximately somewhere between 37 and 61%, depending on sort of how you boil the cabbage. But we can say pretty distinctly that 37% said no, they do not do follow-up inspections, even though they might require permits and plan reviews in advance. And quite a few people just were unsure. Almost 20% were unsure. And I think that speaks to one of the weaknesses of our study itself, in that we couldn't control who received the research questionnaire. It was sent out through the membership of ISAC with their wonderful cooperation, but we didn't want to know who you were in terms of your contact information or your email or what county you might have been with. We wanted it anonymous because we're not in the enforcement. None of this is reported to the federal government. This is between us. So we wanted to keep that anonymous. Next slide, please. Probably more now than ever within this pandemic, and there'll be other pandemics, we're finding that internet access is critical to everyone, right? Not just to people with disabilities, but put yourself in the position of a person with a disability who can't drive, or who has a motorized wheelchair and can't get out at the moment, or doesn't have the assistance, or a person with blindness. And so the web access is a critical feature. And you might remember that earlier I mentioned that every program, every service and activity that you offer must be accessible. That includes your websites. And so I know that in Nebraska, there's a group, I'm not advertising for them, called Civic Plus. And Civic Plus is a webmaster for, I think, all of Nebraska jurisdictions, as well as for the state. So they oversee the state websites, as well as a majority of the smaller jurisdiction websites. And they're quite adept at understanding ADA accessibility on a digital scale. And so what we saw in Iowa is that, again, about a third of your respondents are saying you haven't haven't implemented a process or a policy toward internet access and accessible web pages. And so again, we've got this 17% unsure, uncertainty of people, and then 31% who just didn't respond. We don't know why there. So this is an important feature for you. And I'd say it's a take home, one of the important take home messages besides the ADA coordinators is that your websites must be fully accessible at all times. Let's go on to the next slide. I think if I remember, yes, I wanted to bring this slide up. So basically, everything I do is accessible. This particular PowerPoint needs some tweaking because we were in such a rush to get it together. So it is, I'm just going to come right out and say it. I'm not satisfied with its level of accessibility, but some of the basics are the color of my slides, the contrast. So you want white on black, black on white, white on blue, blue on white. Your font must be sans serif, such as Calibri or Arial. These are the basic requirements. And any banners or graphics or photos must be what's called alt tagged. In other words, they must be described by you so that a digital screen reader can read what's in that photograph or banner back to the person with blindness. I will point out that there are some excellent guidelines for you called the Web Content Accessibility Guidelines. Those are the ones we use at our ADA Center for all of our websites and for all of our digital footprint. And the last thing I want to point out is that there was a court case just a year and a half ago at the Supreme Court where Domino's Pizza lost to a gentleman named Robles because Domino's Pizza website was not accessible. There have been literally thousands of website accessibility cases filed in the last 2 years, especially since the pandemic. So just a word of advice there. Next slide, please. Candace, do you have anything you'd like to jump in on this?
No, not at this point.
Candace is the person who we all are thanks to for these wonderful graphs and for the graphics and for analyzing and putting together all of this information for us. And so I want to make sure that that anything she's got to say, that we have that opportunity. Without physical access, such as to your government building, or let's say to shopping or mom and pop stores downtown, or to transportation hubs like bus stops, trains, etc., you're increasing the person's risks for not getting the health care they need, not getting the services or the goods that they need. Obviously, we're talking about access to their lawyers and legal services or advocacy to schools, to libraries, etc. So we wanted to look into that question, not just access to government, but access to the rest of your community. And you can see by the slides here that that quite a few, about 31% again, we just didn't want to respond and didn't feel comfortable in responding. But quite a few felt that their access was just slightly convenient or moderately convenient, as opposed to extremely convenient or very convenient. And so this speaks to the conditions of your sidewalks. This speaks to the conditions of your curb cuts at your intersections. This speaks to the conditions of the steps that lead from the public sidewalks up into, let's say, a mom and pop store or a lawyer's office downtown. So again, we're seeing what we expected to see is that in the rural areas, less access. Next slide, please. And so access to the state and local governments can be by other means. Again, you're allowed to offer your programs online or in other ways that the Title III, that the rest of the community, the private accommodations such as law firms or Walmarts cannot do. So, but there comes a time perhaps when only physical access will work. And what we saw there was quite a few responded that their government buildings, sites, and facilities, which might be parks, might be other areas, are in fact very convenient. That's a 25%. I was surprised by that. We saw 8 respondents that said it's extremely convenient, and then quite a few, about again another 25%, saying moderately convenient. So this was good news here in terms of this slide. We felt that that the governments are probably doing a little better job than the private entities across Iowa in terms of access to your facilities. Next slide, please. But we can't ignore parks, pools, playgrounds, natural or man-made recreation. And the reason that that's important to persons with disabilities is not just recreation as we might think of it, going out to have fun or maybe to get back in shape or other reasons. It's really about lifespan, about longevity of lifespan. As an example, in a swimming pool, there's very little gravity, and it's one of the few places that a wheelchair user is actually free from gravity and free from their chair and almost living a normal moment, if you will. And so recreation represents an entirely different viewpoint than access to, let's say, to a county government building. And so this speaks very strongly to livability and to a couple other of the community capitals we talked about, such as natural capital, et cetera. For people with disabilities, you know, they already have high stress, obviously comorbidities, et cetera. And so access is important, obviously. We saw moderately convenient and very convenient, again, as pretty high, almost 50%, 46% of the respondents saying that they had good access to their parks, pools, trails, playgrounds. And some slides I didn't show you there included like parking for these areas that you're seeing on your screen. We looked at that, and parking reflected this as well, that the parking lots and the parking spaces and the accessible route from the parking was, again, about 45, 46% reported it as being very convenient or moderately convenient. Next slide, please. So the playground areas, I'm sure a lot of you have seen these rubberized mats and these surfaces, if you will. These are not required, but they do meet standards for friction under the ADA, and they meet standards for the surface, for the flatness of the surface and the restriction of the surface, as opposed to, let's say, sawdust or like that. What's important to note, however, though, is that the regulations for recreation, if you have any recreation at all as county government, which I know a lot of county governments do not, it's more cities generally, but any recreation should be following the 2010 ADA standards for accessible design, chapter 10 document. This is the applicable document for all construction, whether it's new or altered construction for buildings. But when it comes to playgrounds, pools, and recreation, this applies now. It applies in retroactively. So you don't have to be remodeling or building a new playground. They apply to your existing playgrounds right now. And so there's quite a bit to be learned there. And we've got experts in that field. In fact, some of the people who helped write the document that I just showed you. So that's an important point to take home too. If you've got recreation, it needs to be accessible today, not later when you are in the midst of a remodel or building a new playground or something. Next slide, please. So water access is extremely important, and you may have some in county government in terms of lakes or even possibly pools. And so the gentleman on the right, top right slide is Bill Botten. He helped write chapter 10 of the federal document. He's at the United States Access Board, and Bill is a wheelchair user. Bill was in a vehicle accident and is now not able to use his legs. He doesn't have mobility. So he's the one that really brought this forward for us. And you're required, just like with your playgrounds, that your pools be accessible now, retroactively, not when you build a new one or remodel existing ones. So I think that's the important point, because again, this gets back to socialization, because people with disabilities are isolated oftentimes. And so recreation pools are great for the exercise, but they're also about learning for children, and they're about socialization for children, and they're about extended lifespan for all persons with disabilities. And I think that's a critical point to take home. Remember, it's 1 in 5 Iowans, approximately. So these may be your family and friends that qualify. It's not just about wheelchairs. There's all kinds of disabilities that are invisible. Let's move on to the next slide. We asked we wanted to know where your communities were in terms of in terms of replacement of these play structures, swings, slides, those composite play structures that are quite expensive. Because as I mentioned a moment ago, the requirements for those to be accessible are retroactive. They apply now, not when you build a new playground or when you decide to remodel and find the money to remodel existing areas like that. And so consequently, we had approximately nine respondents saying it's not sufficient, moderately sufficient 12, extremely sufficient 1 respondent. Again, pretty high response rate, a non-response rate, pardon me, of no answer. And so when you look at the curve there of the people who did respond, it's certainly a point that I think talks to those capitals we base this research on, and that would be financial capital, because you can look at let's go back a slide, 2 slides, please. You can look at these playground structures, you're right there. You can look at any of those playground structures. That's $250,000 in that larger photograph easily. And so where do you find the money for that? And how do you find the money for that? The Department of Justice really is not concerned with when you find it or how you find the money, but that it be accessible now. And so these are very expensive. Let's move back to the 2 slides up again, please. Thank you. So the replacement of the structures can be quite costly. There's no requirement that you have them, but your requirement is that if you install a set of swings, let's say you install 5 sets of swings, 1 of those 5 must be accessible. There's nothing saying you have to put in swings. And so don't be fooled by that. Quite a few county entities in Nebraska were told by these suppliers that they had to provide all this equipment. No, it's only when you provide the equipment. So if you have swings, yes, at least 1 must be accessible. And that's when we get into that when viewed its in entirety. You've got your swing program or your recreation program accessible because 1 of the 5 swings is accessible, okay? Candace, anything you want to add there?
I think you've got it covered.
Okay, thank you. Next slide, please. So public rights of way is critical to persons with disabilities. And we wanted to know more about that within the communities, because this is the interface between their home, your government office, and the rest of the world, right? And I have seen small communities. I was in Sioux City. I lived in Sioux City 7 years. And I'd seen plenty of small communities across Iowa and Nebraska where some of the streets are still gravel or there's no sidewalks at all. There's no requirement that you build a street or a sidewalk in any federal document. It's only when you build it that you must make it accessible. And then when you have sidewalks, then you're going to have to look at how you're going to make at least 1 accessible route, let's say within a block. And so that might involve those curb cuts in the graphic in the upper right-hand side there. There's quite a bit to this. And I'm not an expert on rights of way, but we actually have a couple of people who are, and that's all they do is rights of way. Next slide, please. So I know a lot of county governments are involved in roads and bridges, et cetera. And our 800 number is available to you in this slide or in this presentation at the beginning and end. And we can certainly assist in answering questions there and connecting you to other engineers, architects like myself towards these answers. What we found, though, when we talk about this being a mixed method survey, I'm just showing you some of the qualitative responses here. We found that a lot of the responses that people are planning on budgeting accessible sidewalks and curb cuts, but hadn't started that. And some had started it. In fact, the majority, 25% of the respondents had started it in their higher traffic areas, downtown districts, et cetera. Some have completed it. That would be about 10%. Quite a few were unsure. And then there's some interesting comments. There's one comment that says, we are a tiny town of 84 people and 99% of these questions do not apply to us. I hope I've clarified throughout this that most of these questions do apply even to a town of 84 persons. If you've got a incorporated government there, a county government, then you're required to have a self-evaluation. You're required to be looking at your employment policies and all the things we covered with an ADA coordinator. Regardless of whether or not you're required to have that ADA coordinator, you're required to still follow the same principles. And then these applications of, like, say, rights of way still apply to a town of 84 people. There's the ADA applies across every inch of America, regardless of the size of your community and how remote it is or how rural it is. So I think that these qualitative answers are very interesting. Here's one answer, says we don't have sidewalks. And so I've run into that before, where people are forced to take their wheelchair into the street, or like my dad uses a walker and has to go into the street at times. So then they're going down angled driveway cuts, or they're trying to cross curbs, and then they're in a traffic zone with vehicles. And so then at that point, there should be a set of policies and even protocols, maybe with your police department and your county engineers, about how that's done. Maybe wheelchairs should be required to have a tall orange flag on a pole, so they can be more easily identified, and where are safe places to cross a street or to use a street. Maybe that needs to be striped, and just like a bike lane when you don't have sidewalks. So there's quite a bit to this, regardless of whether you already have a sidewalk or you're a town of 84 persons. And I see there's a comment about this falls under each city's jurisdiction. That's absolutely correct until you cross, of course, and cross the city boundary into the county. But that is true. And we encourage partnering between the state, county, and government engineers when it comes to development of rights of way standards. So how do we cut our curbs? How do we create intersections or crosswalks? Is it okay to have historic brick at our crosswalks, et cetera? Let's move on. Next slide, please. Finally, we wanted to know how effective we've been within Region 7. You see in the map there, we are the ADA Center at the University of Missouri in Region 7. How effective have we been? This was a little disappointing to me and to us in general, that we found that about 15% had never used any of our services or had heard of us. Almost 25% were not familiar with the Great Plains ADA Center. And that's on me. I mean, that's one of the reasons I did this survey, was to learn where you are, your status as a government, and what you understand about the resources available to you, like our ADA Center. And we're not the only one. You've got the fire marshals in Iowa. You've got several human resources and legal advocacy groups. You've got a Human Rights Commission. So you've obviously got ISAC. So you've got all these great resources at your disposal to not only reduce your risks, but to improve the lives of people with disabilities throughout your communities. And that was really the mainstay of why we did this. Let's go to the next slide, please. That's our 800 number. Actually, it's not on that slide. Maybe we can jump back to the top right there. Thank you. So we have time, a few minutes for questions, and for Candace, anything that you need to add.
I don't think there's anything really else that I have to say other than, I think there are several things in this study that were very eye-opening, and that there's a lot of education to be done about ADA issues and regulations in the community, and a lot more work for, the ADA centers, probably not just the Great Plains ADA Center, but the ADA centers across the United States to work on educating jurisdictions about.
Yeah, and we found in Missouri and Nebraska and Kansas very similar findings in terms of the availability and the use, the taking advantage of the resources that are there, and the difference between, again, these rural and what we call remote rural regions versus the more populated regions of all 4 of the states, some more than others, but the trends held up across our 4 states. And if you look at region 3, which is New Jersey, Connecticut, and New York, we found very similar results there. They did a very similar study to ours. So this is not news, but hopefully now those 25% of persons who had never heard of the Great Plains ADA Center, hopefully we got through to some of you, and now you know we exist. And I guess it's time to say thank you to everyone, again, to ISAC and to Beth and Katie for their wonderful support and help for a long, long process here. This has taken 5 years. And did we have any more questions?
I don't see any at this time.
Well, that's great. Okay, apparently not, but our contact info is there if you've got any for us. Thank you all again, and we appreciate your time and support of ISAC in this process.
Thank you.
Thank you all. Goodbye.